Sleep apnea affects millions of people, causing disrupted sleep and posing serious health risks. Traditionally, treatment options like the CPAP machine are the go-to solutions. However, new innovations and treatment methods are emerging to manage this condition. Dental devices and orthodontics are now available as alternatives or complements to standard treatments. These options can offer relief by addressing the root causes of sleep apnea within the mouth. Innovative dental solutions are significantly impacting the lives of sleep apnea sufferers. Understanding sleep apnea. Sleep apnea is a sleep disorder that disrupts breathing and affects your overall quality of life. It can lead to daytime sleepiness, high blood pressure, and other health problems. Understanding sleep apnea types, symptoms, and diagnosis is crucial for effectively managing this condition. Obstructive sleep apnea, OSA, occurs when the airway is blocked during sleep due to the soft tissue in the back of the throat collapsing, causing frequent breathing pauses. Central sleep apnea, CSA, less common but serious, happens when the brain fails to send signals to the muscles controlling breathing, resulting in no physical blockage. Complex sleep apnea combines both obstructive and central types and may emerge in individuals treated for OSA with a CPAP machine. Symptoms of sleep apnea include loud snoring, gasping for air during sleep, morning headaches, daytime sleepiness, and difficulty concentrating. Diagnosis typically begins with a doctor's visit, including a physical examination and a sleep study if sleep apnea is suspected. A sleep study, polysomnography, records your brain activity, eye movements, heart rate, and breathing during sleep. This test helps identify if you have sleep apnea and its severity. There are also home sleep tests, which are more convenient. These tests measure basic metrics like oxygen levels and heart rate, but might not be as comprehensive. Once diagnosed, treating sleep apnea often involves using a CPAP machine. However, orthodontics and sleep apnea dental devices can also be effective options, especially for those who find the CPAP machine uncomfortable or inconvenient. These dental solutions target the root cause by aligning your jaw and keeping your airway open. Traditional treatments for sleep apnea. Sleep apnea is commonly treated with various methods, including machines, lifestyle changes, and surgery. Understanding these options is crucial for effective treatment. CPAP, continuous positive airway pressure. Machines are often the first line of defense for obstructive sleep apnea. They keep the airway open by delivering a constant airflow through a mask, preventing throat muscle collapse and breathing interruptions during sleep. For those struggling with CPAP, lifestyle changes such as weight loss, quitting smoking, and adjusting sleeping positions can be effective alternatives. If these methods fail, surgical options may be considered. Uvulopalatinopharyngoplasty, UPPP, removes excess throat tissue, while maxillomandibular advancement, MMA, moves the jaw forward to enlarge the airway. Consulting a doctor is essential to determine the best approach. Dental solutions for managing sleep apnea. Dental solutions are increasingly popular for managing sleep apnea, providing an alternative to CPAP machines. These devices help keep the airway open during sleep, relieving symptoms. The two main types are mandibular advancement devices, MADs, and tongue-retaining devices, TRDs. MADs reposition the lower jaw to prevent airway collapse and fit snugly over teeth, allowing for adjustments to find a comfortable position. In contrast, TRDs hold the tongue in place using a suction bulb to prevent it from blocking the airway. Orthodontics for sleep apnea. Orthodontic treatments can offer a unique and effective way to manage sleep apnea. Orthodontics for sleep apnea works by repositioning and adjusting the structures in your mouth to improve airflow and reduce breathing interruptions. Several orthodontic options can help alleviate sleep apnea. Many people cannot tolerate wearing a CPAP every night, says dentist Dr. Scott Schmidhauser. For patients with mild to moderate sleep apnea, oral appliances are a helpful alternative worth considering. Braces can correct misaligned teeth and jaws, potentially alleviating airway blockages. By gradually adjusting teeth positioning, braces create more space in the mouth and throat, leading to improved airflow and reduced breathing resistance. Palatal expanders widen the upper jaw, enhancing nasal passage space and reducing sleep apnea symptoms. While often used in children and adolescents, they can also benefit adults with narrower jaw structures. Other appliances, like mandibular repositioning devices, Shift the lower jaw forward to prevent airway obstruction. Tailored to individual needs, these orthodontic treatments for sleep apnea can significantly enhance sleep quality, oral health, and overall well-being. Consulting healthcare providers is essential to finding the most suitable treatment for better sleep and a healthier life. Thanks for watching, and don't forget to like and subscribe.